Thank you. So today, very important topic we are going to discuss. You are all heard about the Abraham Maslow theory. Abraham Maslow theory, you heard?
Yes, sir.
So there is a hierarchy of needs. One
The
theory is
hierarchy
there
of needs. Yes, sir.
as per Abraham Maslow. So he divided the person needs in a hierarchy way. In that, the bottom level, the basic needs of the person is food, shelter, water, air. Correct, no? He has given all these things.
Yes, sir.
In that, sex has become a basic need he has given.
Basically, yes, sir.
Sex also like a food. He has given. It is also a basic need of the human. So people are nowadays, most of the people are able to fulfill their basic needs like food, like water, like other things. So they are unable to meet some other needs. It is becoming a problem. Because of some problems in sexual activity of the humans. That problems we are going to discuss in today's class. So there are some disorders in sexual activities of humans. In our book also they given very clearly all the disorders. And I am going to present today this thing. Okay. Today's topic is sexual and gender identity disorder. See, everybody will have some sexual orientations. But here only some problems are people are encountering. So under the sexual disorders, DSM has classified into 3 levels. I am audible clearly?
Yes, sir.
Okay.
Yes, sir.
The first one is gender identity disorder. Second one is sexually dysfunctions. And the third one is paraphilias. So we will discuss in detail about each one. Okay. Sexual dysfunction means some disruption in sexual functioning of human. It may be aversion problem or it may be erectile problems. All are coming under sexual dysfunctions. And another one is gender identity disorder. In this gender identity disorder, people are believing they are in the wrong sex. They are in the opposite sex. That means from birth, biologically, what sex they are having, they are not believing that sex. We are in opposite sex. That is the condition with the gender identity disorder. And next, paraphilias. These paraphilia disorders, it is also people will get aroused here, not with humans. They will get arousal, non-human objects or some activities. Normally, humans will get arousal by seeing the opposite sex. But in paraphilia disorder, humans will get aroused by seeing some objects or some activities. So this comes under paraphilia. So DSM again, see everywhere DSM is important. For every disorder, there is a criteria you have to go through into your textbook. What are the criteria for each and every disorder? They mentioned very clearly in your textbook. So under sexual dysfunction, there are some categories. Again, 4 categories they mentioned in your book. Sexual desire disorders, sexual arousal disorders, orgasmic disorders, and sexually pain disorders. So these are all the 4 disorders. Because of these disorders, people are unable to enjoy sex or participate into sex activities. Because of unable to participate or unable to enjoy sexual activities, we are calling these as disorders. Okay, let us come to first sexually dysfunctions. What are the sexual dysfunctions? Sexual dysfunction is for some people it is a lifelong condition. But some people, they acquire this disorder after a certain period in life. But both comes under disorder. Both will give some dissatisfaction to the humankind. Lifelong means it is a chronic condition. So entire sex life of the person, this disorder will be there, the chronic condition. And acquired condition, the person will experience, in the beginning he is having normal experience about sex. After some years, because of various reasons, he will acquire that condition. So, but both the things will happen, dysfunctions of sexually. So let us discuss each one by one. These actually dysfunctions will happen because of medical reasons and physiological reasons and psychological reasons. But all the 3 areas people are facing any one problem, those who are having this type of problems. So the first one is sexual desire disorders. Desire. They don't have much desire about having sex. In this, the first one is hypoactive. Hypo means less. Hyper means more. So we are discussing hypoactive sexual disorder. Here, a person with hypoactive sexual disorder has little or no interest. They have very little interest in sex. Some people don't have any interest to have some sexual activity. It is difficult to assess low sexual desire and a great deal of clinical judgment is required. Okay. It may be assessed by frequency of sexual activity. See, the person is having hyposexuality activity. How to decide? The person frequency of sexual activity is very less. That means the person who is having hyposexual activity desires, just he will have a sex monthly twice. So he is having some less activity because of his requirement is very hypoactivity. Because of some problems he is having, but he don't like to have sex very frequently because of his hypoactivity, less interest in sexual activities. So this will be called hypoactivity sexual desire disorder. And the second one is sexual aversion. Aversion means totally disliking. So here, these people will averse the liking of sex because of fear or because of some pain, because of disgust. Mostly the people aversion comes because of pain. For some people, whenever they appear for try to participate in sex, some traumatic memories about sex they will remember in childhood or in their family members. So those type of experiences will create some fear. So because of that, they dislike sex from childhood or from middlehood also because of some trauma in their life. So these people totally dislike sex. Some people are fear, some people are panic, some people disgust, some people may have traumatic experience in their earlier life. So this will be called sexual aversion disorder. And another problem is sexual arousal disorder. You are all seeing my slides?
Yes, sir.
Okay, good. Arousal is a very serious problem. Disorders of arousal are called male erectile disorder and female sexual arousal disorder. These problems will have for both the people. For male also erectile problems and the female also arousal problems. Any one of the partner is having this type of problem, the other person will not get satisfied. Here the problem is not the desire. Both are having desire. But even though they are having desire, they are not getting aroused. That means the strong sexual interest should arouse in their minds. See, actually, sex is not a physical, sex is a mind related. But most of the people do not think it is a mental activity. It is only purely mental activity. When mentally people get aroused, then only they will get sexually functioning. So here it is not the problem of desire. They are having desire. But even though desire is there, they are not getting function. That is the problem. Here the mentally they are getting aroused, but physically they are not getting aroused. That is the problem. Because some reasons are there for this. So sexual arousal problems also there in dysfunctions of sexual disorders. And coming to orgasm. Orgasm is the final stage in sexual activity. But here, many people will have sex without orgasm. That is the major problem here. So for orgasm disorders, also happening because of two reasons. One is inhibited orgasm and premature ejaculation. So most of the cases is happening before going to have sexual activity. They are not prepared. Only one person got prepared, other person not prepared to have sexual activity. In that scenario also, this orgasm problems will develop. And the second condition, premature ejaculation. Even though the other person interest not achieved, the first person will get, he will satisfy, he will complete his course of action. But ultimately, both should getting satisfaction in their physical activity. If both the people are fully satisfied, means it won't come under orgasm disorders. Anyone not satisfied because of various reasons, it comes under orgasm disorders. And the other condition is sexual pain disorders. Here, the intercourse is very painful for some people. For these people, sexual desire is there, desire is present, arousal is there. But here, having intercourse is become very painful for some people. Because of that, they will try to avoid because of pain, too much pain. So this will be called dyspareunia. So this problem is more in female comparatively men. In men, it is only 1 to 5%, and in women, it is 10 to 15%. So, vaginismus. Mostly, this is related to women only. So, mentally, they are not prepared. In that case also, this problem will have some serious effects with the females. So we have discussed the different types of problems in sexual dysfunctioning. The first dysfunction is hypoactive sexual desire. The second one is sexual aversion disorder. Third one is sexual arousal disorders. Fourth one, orgasm disorders. The fifth one is sexual pain disorders. But anyhow, any problem, any disorder is a problem. So next we will discuss about causes, why sexual dysfunction is happening. A number of physical and medical conditions contribute to sexual dysfunction. So there are some physical conditions, some medical conditions also contributing to this problem. Neurological diseases and other conditions that affect the nervous system. Nervous system will get affected because of diabetes and kidney diseases. So these two are somewhat problem biologically. And again, vascular disease. So vascular disease also create dysfunction problem, particularly this erectile problems in men, it will happen. And in women also, vaginal engrossment. Here what happened? The vascular problem is there means the blood will not flow properly to the genitals. So that is related to vascular disease. Whenever there is a thought, sexual thought, arousal happen. Arousal means the blood will flow majorly to the genitals. So here, because of vascular diseases, this problem will come. And again, chronic illness. Some people are having some chronic illness, particularly about the heart. So already they are having that preoccupation about their heart problem. For them, a physical exercise will become a somewhat a fearful thing, because already I am a heart patient. Heart patients should not be much have physical activities. So that type of, because of chronic conditions, it will also become some problem. And another cause is medications using. Some people are having high blood pressure and they are using regularly medications, because those medications also will create some dysfunctional problems. And depressants, some people are using because of psychological problems or some other reason, antidepressants, particularly for anxiety disorders and depression disorders. People are using some medications continuously. So those medications will have some side effects. So with those side effects, people will have these dysfunctions. And the last one is regular consumption of alcohol or drugs, drug abuse. So particularly this cocaine and heroin. So the people, those who are using regularly or very frequently this cocaine and heroin, so these people also will experience this type of dysfunctional problems. So what we discussed so far is biological. These are what total all the causes we discussed related to biological here. Now psychological contributions also there. In psychology, human psychology condition of for sexual dysfunction is anxiety. It may be due to work pressure. It may be due to some other financial problems. Some anxiety people are getting developed nowadays. And another problem is performance anxiety problem. Whether I can able to perform properly in sexual activity or not. That type of problem some people are having. So that anxiety, even though he don't have any sexual dysfunctions problem, he don't have any erectile problems, because of anxiety is running in his mind, he will get psychologically disturbance. Somebody, see, I request everybody to mute. So the psychological conditions, particularly about the performance anxiety, will create this type of problems. And some places interaction of both psychological and physical factors. physically and psychologically problems both getting interacted, also creating dysfunctional problems. And here about treatment. What is the treatment available for this type of conditions? Sexual dysfunctions or disorders. What is the treatment available? There are two types. One is psychological treatment, another one is medical treatment. So this program involves a male and female therapist, to facilitate communication between the dysfunctional partners. Therapy is conducted daily over a 2-week period. In addition to providing basic education, psycho-education, they provide. See, in most of the psychological disorders, psycho-education is must. Here, the psycho-education they provide about the sexual functioning, how sexual functioning happen in humans. And they will try to remove the myths. Some people will have some deep-seated myths, మూఢనమ్మకాలు. And they will try to increase the communication between the partners. So that is related to psychological treatments for the people, those who are undergoing with the dysfunctions. And another way is medical. Because particularly in medical means they will have hormonal testing. They provide through testosterone and estrogen areas. They will observe in the person, those who are having this type of problem, some medications to improve their hormonal levels in the body also, doctors will take care. So these are all related to sexual dysfunctions. How many types are there sexual dysfunctions? What are the causes? And what are the general treatments we have discussed so far related to sexual dysfunctions? Anybody want to have any interaction in this, or shall I move to next?
Let me move to next, sir.
Okay. So coming to gender identity disorder. Gender identity. The person what he is having gender, he cannot accept that gender. Being a male, he cannot accept I am a male. That means he is not accepting his biological gender. He is accepting the opposite gender only. So this will be called gender identity disorder. So gender identity disorder is present if a person physical gender is not consistent with the person's sense of identity. He is sensing my gender is different, but his biological gender is different. People with this disorder feel trapped in a body of the wrong sex. I have trapped in a wrong body. My sex is different. That type of feeling strongly they will develop. The primary goal is not sexual. The person's primary goal is not sexual, but rather the desire to live life openly in a manner consistent with the other gender. Here, the primary goal of this person is not the sexual, but his feeling is to live openly. Even though he is a male, he wants to live openly like a female. That is the strongest desire. So these people will be called affected with the gender identity disorder. But individuals with gender identity disorder, by contrast, have no demonstrated physical abnormalities. Normally, these people appearance, seeing their gender is as for their physical only, but they expect always we are in the opposite gender. Their behavior will be like that only. Opposite gender behavior only they will exhibit. So for this, what is the cause? Earlier research suggested that as with sexual orientation, slightly higher levels of testosterone or estrogen at certain critical periods of development. Hello?
Yes, sir.
Okay. Early research suggested that as with sexual orientation, slightly higher levels of testosterone or estrogen at certain developmental periods time. See, during developmental period, the hormonal differences has caused this type of problem. So what is the treatment available for gender identity disorder? Treatment is available for gender identity disorder in a few specialty clinics around the world. It is available even in many places, many cities, gender identity clinics are available. Here the problem is, although much controversy surrounds treatment, see in this treatment there are so many controversies. But at present the most common decision is to alter the anatomy physically to be consistent with identity through sex reassignment surgery. It is happening in India also, they are doing this. So normally these are very rare problems. The problems those who are facing, they are having a strong desire to go for surgical procedure to alter their gender. It is very strong desire. Otherwise they say, I don't want to live like this. I want to die myself. Such a anxiety they will have always regularly. So this is related to gender identity problems.
So I have a doubt. May I ask?
Please.
So here we discuss the causes of this one. So the causes says that it's purely because of genetical issues. Is there any chance that people psychologically getting influenced to change the gender? Because in social media also we see, like back then we never had this gender issues. Like we
See,
hardly, rarely used to see.
First thing, we should not much depend on social media. Actually,
Yes.
for social media, there is no authentication. People, those who are having good knowledge also, they are uploading in social media, and lack of knowledge people also uploading in social media. Suppose if anybody, any person requires some suggestion, it is better to have a consultant, no?
But then my question is, is there any chance of getting influenced and feeling that they are of opposite gender, or is it purely genetical?
No, it is purely physical. In the body, there is some variation, hormonal variations only. Those hormones are dominating them. So hormones definitely change their behavior.
Okay.
So the hormonal dominance will influence his behavior.
Yes,
Okay?
sir. Yeah. Yes, sir. Got
Okay.
it. Yes. Thank you.
Okay. So we discussed so far this identity, gender identity disorder. Another one is sexual dysfunctions. Both are coming under sexual disorders. Now the third one is paraphilia. Paraphilia Here, paraphilia means people will get aroused. People will become sexual activity by doing some activities. Those activities socially also not acceptable. That is the reason it is called disorder. So I will read, just try to understand. Paraphilias are defined by DSM-4-TR as sexual disorders characterized by recurrent, intense, sexually arousing fantasies, sexual urges, and behaviors. See, paraphilia is a fantasy. It is a sexual urge or a behavior. Normal sexual arousal privately is not a problem. But if it happens publicly for arousal activities, it is not a norm in our society. So definitely it will become some type of disorder. So these people, what they do for having their sexual stimulation or arousal, they use some non-human objects. Non-human. See, having human, looking human, having arousal is okay, common. But non-human objects, they want to arouse. They want to exhibit some behavior. They want to live in fantasies just by seeing non-human objects. And another condition is creating suffer in opposite person, opposite partner, or humiliating the other person. Humiliating the other person in sexual activity. These two are related in sexual activity only. This is also called paraphilia. Sadism, we say sadism, no? And making insult during sexual activity. So these also coming under paraphilias, because in sexual activity, suffering other person, one person is enjoying, it is not a good condition, no? Or humiliating the opposite person is also not a proper sexual activity, no? That is the reason these two are coming under disorders. So the disorders are here called as paraphilias. And the third cruel condition is getting attracted towards children for sexual activity. So children or other non-consenting persons. Children are non-consenting. That means unacceptable. So this type of conditions a person is having means those conditions will be called as paraphilias. So in paraphilias also there are different disorders. We will come across with one by one. The first condition is Freudianism. So these words for pronouncing is a little difficult because regularly we are not listening this type of names. So pronunciation may be little difficult in the beginning. So Freudianism refers to a paraphilic interest in rubbing. Usually one's pelvis or erect penis. They will try to rub with the other person's body part. by rubbing this type of, by doing this type of activity, they want to have sexual gratification. See, here these people won't participate in sexual activity. By rubbing his genitals with other person's body part, they will get some sexual gratification. So this is called Freudism. Some people are there. Normally, it will happen in hostels. Hostels, it will happen many times, many conditions we have seen like this. And fetishism. In fetishism, a person is sexually attracted to non-living objects. See, normally by seeing pictures, human pictures, some people will get aroused. Or some people, males, particularly males, by looking the woman garments, without seeing the woman, just by seeing the woman garments, they will get aroused. They will get some sexual gratifications, fantasies. They live in fantasy. And shoes also are popular items for the related to fetishism. So fetishistic arousal is associated with the two classes of objects activities, that is inanimate. Normally, these are all objects are not living objects, inanimate. So these conditions will be called as fetishism. And the next condition is voyeurism and exhibitionism. So in voyeurism, here also these people, in all the conditions, people will try to arouse. What they do, here, secretly they will see the other person in undressed condition. Somebody is taking bath in bathrooms, and looking secretly without observing by them. So by looking secretly the other naked body person, these people will get aroused. And here exhibitionism is there again. So it is not opposite to voyeurism. And voyeurism is a secrecy act. But exhibition is not, it is opposite to secrecy. These people openly expose their genitals to unsuspecting strangers, not familiar people. With the stranger people, they will expose their genital parts for their gratification. Here they enjoy some thrilling element, just to have some thrilling. This exhibitionism they do. And next is transvestic fetishism. In transvestic fetishism, so some people, rarely we also observe this, they use opposite sex dressings for their own dressing. Males will wear the females' dresses. See, by doing this act also they will get some satisfaction, some fantasies. This is called transvestic fetishism. And Other paraphilia is sexual sadism and sexual masochism. These people in sexual, this is also a sexual activity, but these people don't bother about opposite person condition. They try to enjoy sex by creating some pain in the other person. Sadism. So these activities also coming under paraphilia. And the last condition, pedophilia. Pedophilia related to children. These people are getting attracted towards sex arousal they are having by looking children. This is called a pedophilia condition. See, these are all deviant conditions in our society. Society will not accept. That is the reason all these related paraphilia conditions are disorders. And only we discussed some of the paraphilia conditions. There are some conditions even not specified, not named also. There are some conditions are there. Anybody's want to discuss?
Sir, one doubt. Now you told me just day before yesterday I read one article. One person raped around 6 years old children. So now he is arrested under the POCSO, and moreover that he is punished. So how we can through counseling? Now you told us these symptoms. We can, as a psychologist, we can identify and we do the counseling for that guy. Maybe after his imprisonment and all, he came out again. He may do something like that. So we can do some counselings.
Yeah. See, normally the people, those who are doing some crime, to make them, to reduce their the impulsivity in their thoughts and behavior, even in jails also, counselors are working.
Okay.
In jails, counselors are working regularly.
Okay, sir.
So the counselors will do their therapies for them.
Okay. And
But
how to identify such kind of persons? How we can identify, as and when we are moving in the society, how we can identify?
correct. Those who want to do some theft and all, can you identify immediately? They act very nicely.
Yes.
Sometimes it is very difficult.
Okay.
Because we have to maintain some distance with everybody, and by believing everybody, by trusting everybody, we are allowing them. That is the problem. See, opposite person personality judgment is very, very difficult. As per Sigmund Freud theory also, the psychoanalytic theory also, what it says, the human personality is only visible 10%. He given one iceberg experiment to create understanding within us. Human personality is only visible 10%. That is only consciously something you can observe. But there is a subconscious and unconscious personality that is hidden. We can't see outside. How you find out that personality? What is the other person intentions? We can't find now immediately, easily.
Yes, sir.
So in that cases, chances are there happening this type of things. Okay.
This is neurological disorder, sir. Like
Huh?
neurological, this natural, like neurological disorders? Is this
Psychological. These are all psychological disorders.
psychological? So we learn by society or from surrounding, by seeing
Psychological
movies.
disorders. Psychologically, they want to get some satisfaction. They want to get arousal. They want to get their desired gratifications by doing this type of activities.
So this can be hereditary also. So if some person has that, their children have this problem.
Some problems happening.
So again, related to transgender, sir. It is biological, no? So means by natural.
Biological.
Hmm.
The causes are biological. Biological dominance creating psychological problems. Hormonal, biological. Hormonal is biological, no?
Yes, sir.
So the hormonal imbalance in the body is affecting psychologically thinking also.
Yes, sir. Thank you, sir.
And I want to give one example. The related question, how people are getting affected. This particularly paraphilias. I don't know when I discuss this type of things in the class or not. If nobody is having objection, I will discuss. Otherwise, I don't raise this topic. Okay.
Discuss, sir. Sir, no objection, sir. No objection.
It is for educating, no, sir, for knowing the problems in the society, for educating. So please discuss, sir. Otherwise, we will
Yes.
not come to.
Yes, because every parent should know this, the difficulty, what we are facing today in counseling sessions. See, having sex is a very natural course. It is a human basic need. Nobody can deny it. And some private place is required. Some secrecy is required in sexual activities. Some parents has come to us one day. Their complaint is, we have one daughter, one son. My son is doing sexual activity with my daughter. That is the complaint. So anybody will wonder by listening this, because some parents, they don't maintain privacy and secrecy. Reasons may be various. Some people don't have proper facilities. Some people, they neglect the surroundings. Some parents, they don't bother about whether their children are asleep or not, or their children are watching their activity. So this type of conditions is creating problems in the children's mind. I think you can understand. I did not go elaboration in this matter. If we listen really this type of things in counseling sessions, parents coming with this type of thing, really everybody will get surprise and panic also. It is the problem of not children. It is the problem of elders.
Children are modeling, sir. Just recently we have completed modeling lesson.
Yeah.
Modeling.
So that is the reason I am saying certain things are private only. So this much serious problems coming nowadays. In counseling centers, we are seeing this type of problems. Okay, paraphilia not otherwise specified. So something we have specified earlier in paraphilias. Here something not specified, some other disorders are there. This category is included for coding paraphilias that do not meet the criteria for any of the specific categories. Examples include, but are not limited to, telephone scatologia. These people, what they do, in telephone only, they talk a lot of rubbish, sexual rubbish. And another condition is necrophilia. See, by seeing the dead bodies, they will get aroused. They will get sexual satisfactions. Inhuman, unhuman things, all these things. And another one is partialism. Partialism means one person will concentrate only on somebody body part. By looking the body part, a male is looking focusedly on some female body part. He is getting fantasized. This is called partialism. And zoophilia. Rarely we are also listening. So people are getting fantasized with animals. So these are all related to human paraphilia conditions. So let us go to this causes of paraphilia, what it is causing. There is no clear-cut conditions for this paraphilia. Deviant patterns of sexual arousal often occur because these are all very deviant patterns for sexual arousal. These are not normal sexual arousal. This is very deviant from normal thing. In the context of these type of deviant sexual arousal problems occur in the context of other sexual and social problems. These are all happening because of other sexual and social problems. In many cases, an inability to develop adequate social relations with the appropriate people. That means inability to develop adequate social relations with the appropriate people for sexual relationships seems to be associated with a developing of inappropriate sexual outlets. So for this also, the major thing is psychological treatment only. By doing counseling, the unconscious person's motivations, taking out unconscious motivations, unconscious urges, unconscious desires, we have to take out through therapy sessions. Those unconscious problems we have to attend. Then only this type of problems will get some minimized in the person. So we have completed the sexual dysfunctions and disorders. With this, the unit has completed, and we are having last unit. It is all related with therapies, biological therapies, behavioral therapies, psychological therapies, all the therapies. So now we have another 30 minutes time. If anybody want to discuss anything, so far what we completed in our physical class and online class, if any doubts, you can raise. We can discuss for 5-10 minutes, and then we will go to other topic.
Sir, can you suggest any important questions for this topic?
Sir, normally in this unit particularly, the schizophrenia and substance abuse disorders, sexual disorders, out of these three compulsory questions will come. Long questions will come mostly in this.
Okay.
See, in your textbook, in every chapter end, they given very clearly some questions. Correct? From those questions only, you will get examination questions also.
Okay.
Okay, sir.
So, will that be enough if we read only those questions? Actually, those questions almost covered whole unit. So, will that be enough for the exam point of view?
I think so.
Once again, I am requesting all the psychology students, please forego the idea of examination point. Psychology, every line, every sentence is important in book. See, examination point of view, okay, you will pass the examination. But what about your applicable knowledge in future?
Yes, sir.
So in psychology, you should not take any choice. You have to read the entire textbook. You have to memorize, comprehend whenever it is required. But people, those who are interested only in examination point of view, it's not correct. In psychology, it is not correct. Try to understand your examination is having lot of time. Only it is in August 9th.
Yes, sir. August 9 to 12.
There is another lot of 40 days, more than 45 days. Time is there. This is more than sufficient. Daily, you practice 1 hour, at least 1 hour. Daily, 1 unit you read. Totally, in each book, you are having 22, 23 topics. 4 books, you are having totally 90 topics. Daily 2 topics you complete. Have global knowledge, not in particularly one area, one paragraph knowledge is not sufficient in psychology. Because the first para knowledge is required to understand second para. See, that is the psychology. I am sorry if I am giving any wrong answers to you.
No, sir,
Because
You are absolutely.
once again, I am saying, I qualified for MPhil examination only by reading our books only. I didn't see in any other book. That much confidently I am saying, our books are very good knowledge is there. When you are going through our book, any elaborate knowledge, if you want, you Google it. You will get very good explanations for each and everything. But don't limit your knowledge only to examinations. It is not good. Qualifying is important, but I am not denying. But same time, with certificate, what you will do? Without knowledge, you have to read books, you have to qualify, and same time you need some internship type. Practical exposure is required for every psychological student. Then only you can solve some problems, you can do some counselings. MSc Psychology qualified people, they can do counseling very happily if you have all the knowledge of counseling. You don't require any license for doing counseling and all these things.
Sir, in one sentence, you gave good direction for us, sir. 90 chapters to each day 2 chapters. That is proper. That is enough, sir.
Correct, Amma,
Better
but already we have overcome so many days now.
with your good guidance, we nice time also.
But planning is so good.
See, normally how students are behaving, in examination point of view, 1 week before only, out of book, there are suppose 20 topics are there. Anyhow, choice is there, na? Let us complete 12 topics. We will
That
get.
is correct, sir. First పుస్తకాలు తీసుకున్నప్పుడు మొత్తం అన్ని 4 సబ్జెక్ట్స్ కలిసే ఉన్నాయి సార్. దేనికి డిఫరెన్షియేట్ లేదు. ఆఫ్టర్ అటెండింగ్ క్లాసెస్ దేనికి దానికి పారామీటర్స్ తెలిసి డిఫరెన్షియేట్ చేయటం తెలిసి చక్కగా గైడెన్స్ బాగా సూట్ అయిందండి మాకు. చాలా చాలా థ్యాంక్స్.
You are all very lucky people pursuing psychology. You are very lucky people, I am saying.
Thank you so much, sir.
Really, sir.
Not for the examination purpose. We have chosen the psychology because I'm from different background. I've chosen psychology just self
also
and get the
observing each and every situation in psychological point, sir.
See, I studied like that only. I am telling you now, I belongs to 2018 batch student in your university only. I finished my PG in 2019 February. 2019, just 5 years before only I finished PG. In 2019, with the same books, with the help of same books, appeared for entrance examination for MPhil. I qualified. I am fully confident.
We are very lucky to have you as a faculty, sir.
No, no, ma. Everybody is lucky if they do hard work. That is important.
That's
only daily looking books and seeing books will not give the chances to us. And same time, by not only reading books, you can have some practical exposure somewhere. That is very much important. Okay.
For that practical experience, how do you guide us, sir?
So many, see, there is a NIPIT institution is there in Secunderabad. They are giving internship program for every month, monthly, 3 months, 4 months, they are giving internship program. Or IMH, Institute of Mental Health, Erragadda, they are also providing internship.
Okay, sir.
So if you have some internship, you will get some clear understanding, practical exposure, you will get basic exposure, you will get.
We tried that also, sir.
Okay.
Nice guiding, sir.
Regarding disorders, is counseling enough, or why if punishment is given, they will be changing, sir?
No, punishment is not the solution. See, for any behavior change, there are only 2 techniques available in this world. One is reinforcement, another one is punishment. But punishment is a last option. Reinforcement means encouraging, motivating is very important, particularly for children area. That is behavior modifications. They use only reinforcement and punishment activities. Punishments also not physical punishment. What the children are enjoying certain benefits, they will reduce the benefits. They will remove the benefits. Those will be called punishments. Clear?
Sir, so basically, any behavior that increases, like positive or negative, that increases a behavior is reinforcement, and anything that decreases the behavior is punishment, right?
No. By doing both the things, we can decrease.
Sir, reinforcement in general means only increasing of a behavior, right, sir?
No. For reinforcement for increasing, okay, and punishment is for decreasing.
Yes, sir, that's what I said. Anything that behavior, positive behavior or negative behavior increases is called reinforcement. Where the behavior decreases is punishment, right, sir?
Yes. There are other techniques also there. Once you come to that behavior management studies, then you will understand all these things.
Okay. Thank you.
Sir, good afternoon, sir. University center will be our exam center, sir, or other?
Mostly in other places also, I think they are having now.
Okay, sir.
Now recent years, they are conducting practicals in other centers and examination also other centers. But anyhow, you will get notification in all ticket, no? Everything, where is your center, everything.
Yes, sir. Thank you, sir.
Thank you.
So the disorders can be controlled or can be corrected or decreased, that is, which are negative now, affecting the society, by counseling?
Which disorder?
Now, like this, the sexual disorders. by seeing movies, especially on YouTube, the Tron one and this one. We are coming to know that the highly means literated, not educated IT people or other one, they are not satisfied by physically, so they are trying to do this type of things. Some crimes, this one, this type of things are sexual related things are issues are increasing, no sir. So
Yes.
like a group counseling. Can we means can we influence? Can we see effect and influence that having a positive, good society?
See, one thing, presently the exposure is too high towards media and YouTube, all these things. But we can't stop exposure nowadays, because if you stop directly, indirectly they will get exposed, no? Secretly. See, nowadays children are closing their doors. What they are looking also, parents are having lot of suspicion. And children are not allowing their parents to enter into their rooms. Many clients are coming like this. So ultimately, ethical values we have to teach to the children. See, in everybody's life, sex is important. But at what time, at what age, what is the responsibility, all these things we have to inculcate in the children's mind. That is very important. But for this, all these things inculcating, sufficient awareness is required among the parents. If you strongly say to some teenage boy, don't see this, means he will see exactly that one only. Because it is the problem of the age.
Yeah, if we restrict automatically, they will see automatically, forcefully.
Yes. What you say, don't do this, they will do that only. That is
Yeah.
children's mentality.
So for that, we need to give give more discipline and awareness, and we need to say affectionately.
Yeah, see, I will say one thing. Normally parenting is having some authoritative.
Yes, commanding.
Commanding up to even their college level.
Yes,
Parenting is commanding, people are commanding.
Yes.
But we are all come across with that age.
Yeah, we
See,
cross that. Yes.
children will accept the authoritative. Once they cross puberty level, they are becoming teenagers. They don't like this type of commanding. So this thing, parents has to understood. Most of the problem is coming with parents only. See, that is the reason once they're crossing puberty age, earlier children, how they are behaving with the parents, their behavior is entirely changing. They are becoming rebellious.
Now totally different.
They are becoming rebellious.
Yes, rebellious.
And earlier days, in childhood, they likes their parents very much. Some children now they are looking, their parents are their enemies.
Yeah, exactly right.
My friends only, my well-wishers, not my friends, not my parents.
Correct.
So this type of atmosphere,
Totally
parents only has to correct.
Yeah.
So parents should learn, they should accept our children has come to some teenagers. They like some individuality.
Yeah.
They like some independency. They don't want to depend on everything on parents. So let us maintain good relations, means like a friendly relation we have to maintain with the children.
Yeah, first parental counseling and children counseling also required for the controlling these bad things in society.
But it will not happen in one day now.
Not one day. So slowly, we can start automatically. The people also think about the past and present, and they will look out the future also. Slowly, they will learn. At least one person will change automatically. That impact will be there in other persons in society also, right?
And the children are getting influenced with the peers, in the peer group.
Correct.
Even though how much restrictions if you put in the house,
automatically,
but the outside peer group is very attractive for them.
Very attractive. Yes. Then automatically
So
they
are
move.
creating influence. What they are doing, they are hiding everything to parents. Without knowing to parents, they want to do. They want to read, they want to see the YouTubes, they want to see the videos, they want to talk over phone, everything without hiding.
Everything. So individuality is gone up.
No, the morals we have to teach to the children. That
Yes,
is very
your
important.
moral values and ethically we need to teach.
As a parents, we need to adapt some good habits and practices at home. Then automatically our children will be also get habituated in that. So we
actually
can
1 minute. If you're having good habits also, it won't work. So everybody is having some good habits, but so motivating the children is very, very important.
Even though they are having good control in the house, the peer influence outside when they go to school, when they go to college, the peer influence, it is dominating. The problem is outside pressure, outside influence is dominating the children. So they are unable to control their impulses. Children will have impulse behavior. Impulse means they do acts without thinking.
Uncontrolled.
Yes. So those things are creating problems, but we should not worry all these things.
Sir,
we have to plan properly.
If we discuss, it's a lot of things will be the discussion, the changing everything. It's so uncontrollable. It's a ocean. To control the society means it won't happen in 1 day or 2 days. It's a long process, and it has to be required all people's coordination, cooperation, including family members and neighbors and other people also required. Slowly.
Okay, in our next class, we are going to discuss about some therapies, biological and psychological therapies. So we are going to discuss particularly one therapy, REBT, rational emotive behavior therapy, and cognitive behavior therapy. So try to participate, everybody. These two things are very interesting things.
Okay, sir.
Okay, sir.
Okay,
sir.
we will give some 10 minutes gap for our next class. I don't want to put more pressure on you.
Thank you, sir.
Because if the faculty is continuing beyond the time, please remind, somebody can remind, no issue, because you need some relaxing time. It is very important to understand the next class.
And also one more thing, sir, like I don't know how to express this. This one, like
what is the wrong?
Host is coming, but host is not actually responding whether classes are going to start or not starting. There is no response from host actually on this. And yesterday what happened, right? More than 30 minutes we waited, but requesting host to respond whether the classes will be happening or not happening. No response at all.
Sir, will there be any attendance for these classes? Because I got the information, like I went through the information today itself, so I didn't attend the previous classes.
Anyone is here?
Left.
Any questions? So next class, the biological therapies There are some brain surgery, chemotherapies, and this non-biological therapies called psychological therapies. Just before coming to the class, please read one's book. You will have better understanding in the class also.
Yes, sir.
Okay, Namma. Thank you. I am
Thank you, sir.
concluding class. Thank you very much for everybody participating.
Thank you,
Thank you
sir.
very
Thank
much
you very much.
for sharing the knowledge and giving us some time for discussion. Thank you, sir.
Okay, thank you.